Good morning, everyone. My name's Paolo Sorelli. I'm Clinical Director for Surgery at Lewisham and Greenwich NHS Trust. This is Tania Silvester. She's the Senior Sister in charge of the daycare unit here at Queen Elizabeth Hospital. And we have just had a fantastically momentous occasion where Ben Travis, our Chief Exec, has cut the ribbon to relaunch our daycare unit. And this is a fantastic moment because our daycare unit has, up till this point, not been able to function as a dedicated unit to our patients who are having daycare surgery. And it has taken a lot of hard work, dedication and motivation from a large number of people to get to this point, to challenge our current practices and to remodel the way we do things to allow far better patient flow and to thus allow ring fencing of this daycare unit so it can work purely from morning till evening and be closed overnight. So every morning we have a brand spanking new daycare unit for our patients coming through. We wouldn't be here without excellent teamwork across the trust, and we certainly wouldn't be here without the support of Ben Travis, our Chief Exec, and Angela Heller, our Chief Nurse, who have really made this possible. And I know that they will be saying a few words. But for now, I'd like to say thank you to the whole Trust for making this possible, and I think this is going to be a real turning point for us, certainly in surgery, and I think the repercussions will be felt throughout the Trust. I'd like to now hand over to Tania, who has been instrumental again in supporting the team really here and the nursing staff, not just through the change, but through the last years, which has been a struggle at times.
Thank you very much. Morning, everyone. As Mr. Sorelli said, I've been the sister here for some time. I've actually seen this unit go full circle. So from the very beginning, when we were here 16 odd years ago or so, the unit was pure day surgery. And over the years, and particularly over the last 8 years or so, really I've seen the decline of the daycare unit, in that the demand for beds within the trust has been so high that our beds have had to be used for inpatient use. This started off, we have 23 beds here designed for our day care unit patients, and gradually these beds have been used more and more for inpatients. So it started with 5, increased to 10, and certainly over the last 3-4 years we would come in, arrive every morning for our shift where the unit should be completely empty and available for our day surgery patients, to find the whole unit, every bed occupied by an inpatient, which has been incredibly challenging for the team. Really competing needs, looking at inpatient needs compared to day surgery patients, which are very different, and the pace of the care that we carry out is also very different. So it has been incredibly challenging. I've always been hopeful because this unit was purpose-built and designed for day surgery, and in the early days it did work perfectly well in that form. So I'm just so excited today. I've always tried to say to my team, you know, I'm forever hopeful it will happen one day, because I've always believed it's the best thing for our patients. And the team that have worked alongside me, and I've been incredibly lucky to have maintained and, you know, kept those staff on board, have risen to the challenge of looking after those different groups of patients. But really our speciality is day surgery, and that's what the staff were originally employed here to do. So on behalf of myself and the team, I'd also like to really thank Mr. Sorelli and our Chief Exec and our Chief Nurse Angela. Also our heads of nursing, Karen has been really instrumental, and Phil, and our matron Kathy. And just really excited and hopeful for a much better patient experience. A much better patient experience for our local patients, and also a better working environment for my wonderful nursing team. So thank you. Thanks very much.
There.
Thank you.
Thank you.